And thank you. It's great to be here. And as you've heard, I'm Elaine, and welcome to this great event this afternoon.
Oh, perfect, Elaine, we can see them.
Fantastic. So I'm sure that, like me, you'll be able to be passionate about the planet. That's one of the things I think that we all share. So I wanted to start by getting you to just take a moment to remember that we only have one. And if our feet are on the ground, we are connected to 65 million other healthcare workers around the world, all needing to use consumables and natural resources to do their jobs. And so for me, it was a bit of a shock, to be honest, to realize that all of this stuff that we use is causing the environment so much harm. I don't doubt that we need it. Well, I'd say most of it anyway, but we're so busy, we don't really have time to think about where we get it from. We get it out of boxes, we take it out of packets, but do we think about what it's made of, or where it came from, or the harm it might be doing? We're starting to think of that, but it's not at the front of the minds. And that's because often the damage is happening somewhere else in the world, to someone else's water or wildlife, or even to other places' livelihoods. And it's when we see things like this, we realize, and it makes us feel bad, I know. But we're improvers. We hate waste, and we want to make things better. We have superpowers. And today we're going to hear how some of you champions have unleashed your quality improvement superpower to help the planet. And you're doing that one small local project at a time. And you're everywhere, from Scotland to Ireland, from Denmark to Poland, all using your own method of improvement to make a difference. And we now know that every little PDSA adds up to some bigger change, which is what we're striving for. And if you choose to look at that improvement with green glasses, almost every project has not just a financial impact, but also a social and an environmental benefit. And that's what we're looking for now: sustainable improvement as a sustainable system, because doing this is what's going to make healthcare sustainable for the future, for those future generations. And it's about these three things: about society, about nature, as well, of course, as the money. And although sometimes we get caught up in looking at carbon footprints, and that's great because now we're learning how to measure it, and of course governments require it, I think as healthcare professionals we'd all realize that it's so much more than that. It's about our water, it's about our air, and actually it's about our behaviors. So every single change we can make at home, or any project, however big or small at work, is another step to alleviating the triple planetary crisis that we face, that sadly we've helped to create. Addressing climate change, reducing pollution, and helping reduce the impact on nature is our job. If only I had known then what I know now, hey, I might have questioned things a bit more. I might have asked why a few more times, and I could have challenged maybe why we'd thrown it away when we didn't even use it. These are things people are asking now, because I didn't really think about where this stuff ended up. So yes, you can be sorry, but don't be sad. You have a superpower. So now you must use it. Be kind, be thoughtful, and try to help others to come along with us. Every tiny step you take is making a difference to the world we all share. So this afternoon, I'm really looking forward to celebrating the great work and being inspired to do more. So thank you, superheroes. You're doing a great job.